Good afternoon, Tan Sri, Dato Sri, Dato, ladies and gentlemen. It is my pleasure to welcome you to our WOU Shares event, COVID-19 Mitigation at the Workplace, How to Prevent COVID-19 from Spreading and Closing Down Your Workplace by Dato Dr Neoh Soon, Managing Director of Soon Group of Companies. Our moderator for today is former Chief Minister of Penang, Tan Sri Dr Koh Soon, who is also Chairman of WOU's Board of Directors. Before I hand over to Tan Sri Dr Koh, here are a few house rules. Today's webinar is being recorded. The webinar is scheduled to last for an hour and a half, including the Q&A. All dial-in participants will be muted to enable the speaker to present without interruptions. In the interest of time, questions should be submitted at any time via the chat box on your respective screens. At this time, I would like to hand over the floor to our moderator, Tan Sri Dr Koh. Tan Sri.
Hello. Yes. Sorry, a hitch here. It should be showing me. Anyway, hello. Good afternoon. Welcome to this webinar, the first in the WOU Shares COVID-19 series, entitled COVID-19 Mitigation at the Workplace, a very crucial concern in our present fight against the pandemic. We are very fortunate to have as our speaker today, Dato Dr Neoh Soon, who will share with us his practical experience in preventing COVID-19 from spreading and closing down the workplace, thus saving lives and sustaining livelihood at the same time. Now, let me introduce briefly Dr. Neoh. Dr. Neoh has a very unusual and in fact unique combination of having over 40 years of experience in leading and growing successfully the Soon Group to be one of the largest food and feed ingredients companies in Malaysia, and yet still keeping up his research interest in the biomedical field for over 50 years, and serving on the board of Lam Hua Yi Hospital, Penang for 30 years. Previously, he has also served in several committees of the Federation of Malaysian Manufacturers, FMM, and in advisory roles in various government bodies, including the Ministry of Health. Dr. Neoh has so much to share within the 45 to 50 minutes allocated. After that, we shall have some time for Q&A. Now over to you, Dr. Neoh.
Thank you, Tan Sri, for inviting me to give this talk. As you know, the COVID-19 crisis happened about a year ago, and we had our first MCO, in March 2020. Since then, about 300,000 Malaysians have caught the disease, and about 1,100 of them have died. Now, this itself is a tragedy, but perhaps the bigger tragedy is that about 100,000 businesses, small, medium, and large, have gone out of business. And probably, 500,000 people could have been made jobless. But of course, because we're not hiring any more foreign labor for the time being, you may not see a huge rise in joblessness, which is currently around 4.5%. But in real terms, the situation is much worse. Now, the economy of Malaysia was growing at 4.3% in 2019. And last year, we dropped, I think, by about 5.6%. So if you look at between 19 and last year, We have dropped almost 10%. And this year, we don't even know if we can meet the 4% target. Now, if we don't stop the virus, then there is no way we can actually solve the problem. Which one? Share. Sorry. Okay, I will go here. All right, so this is the title of my talk, how to prevent COVID-19 from spreading and closing down your workplace. Now, as a company, obviously closing down a workplace is like a nightmare situation because the cost to our company, not only in terms of cost of money, it's also in terms of reputation and in terms of morale. So imagine if you had a major brand and let's say you're in the food company and suddenly you have to close down because of COVID, the damage to your brand could even be unreversible. So it is very important that you don't allow COVID to spread in your workplace. So we'll quickly go through the COVID-19 situation in Malaysia. We tell you what's COVID. It's very important to know what is COVID because as Sun Tzu says, if you don't know your enemy, you can never win the battle. So you need to know what is COVID, right? So why do we need to prevent the spread of COVID in our workplace? That's obvious, but we'll show you why. But you must also about setting up a high-level COVID-19 task force, applying the basic MOH principles of 3W and 3Cs to have an effective COVID-19 control program based on contact tracing and risk assessment. That's most important. Contact tracing and risk assessment. This is the single most important thing you need to do. We use a technical and engineering approach to manage airflow and purify the air conditioning system to prevent the spread of the virus, instituting awareness among our staff, take-home messages, and potential emerging issues. Now, this is a very important chart. It shows for the last 1 week or so, 85% of the clusters of COVID has come from the workplace. Now, what does that mean? It means that even you close every restaurant, you close every supermarket, you close every hair salon, bar, everything, you still have 85% of the clusters happening. So if you don't stop the spread in the workplace, you are never going to solve the problem. This is the most important thing because 85% of new clusters are in the workplace. Now, we don't have the latest figures, but basically about up to, from September last year to February, early February this year, there were about 315 workers screened, 78,906 were tested positive, of which 50 over 1,000 were foreigners and 20 over 1,000 Malaysians. Why is this figure so high for foreigners? Because the government only mandates screening for foreign workers, not for local workers. So obviously, if you only screen foreign workers, you're going to get a lot more. And therefore, do not see this as thinking that it's all foreign workers. In fact, in this country, foreign workers only account for 20% of the cases. So remember that, yeah. Now, obviously, the government is very upset and they make a lot of threats to the industry. Like now, you can be fined 50,000 and jailed for 1 year, okay, if you don't take action. So you have no choice. If they come to your factory and they decide that you're not following their SOPs, you're going to fine you 50,000 and maybe arrest you if you're repeat cases. So what is COVID-19? So we need to understand what this virus is. So basically, it's no different from a common cold virus or pneumonia virus. It's here all the time, coronaviruses. They are everywhere. But once in a while, it becomes aggressive. So remember SARS in 2003? That was a scary thing. Then we had MERS in the 2012, and now we got COVID-19 in the year 2019. So basically, it's like a cold virus, but a lot more deadly. Now, you have to understand the infection timeline. This is important. I beseech you to look at this chart. Normally, okay, if you are infected at day 1, the incubation period is 5 days, where the viral replication is actually at its peak. That means you are already infectious 2 days before any symptom appear. But the viral replication will stop after another 5 days, right? However, the viral debris will go up as the virus is killed and whatever, it goes up. And then eventually about a month, it will taper down. Now, if you don't go to the next phase and you just have either asymptomatic or symptomatic face, then you're not infectious after 10 days from your infection. That means about 5-7 days after your symptoms appear, no longer infectious. That's why MOH has stated that you can go home after 10 days because you're not going to be infectious. That's important. However, if you do progress further, okay, and your body mounts a delayed innate immunity response, okay, and that response is called a cytokine storm, which usually happen in the lungs and the kidneys. Then you go into early pulmonary phase, and then later to late pulmonary phase. So this is about 20% of patients will go down this way. So how to prevent that? Well, that will be a topic for another day, obviously. But we assume for our purpose that our people are young, so most of them will recover within 7 to 10 days, right? So basically, that's what we are dealing with, right? Okay. Now, how is this COVID-19 spread? Well, basically through the aerosol, which you breathe in and out. So these droplets can be passed on to another person, or it can land on some surfaces, and if somebody touches it and put their hand to their face, they are going to get these viruses into their body through the nose and throat. So basically, the most important thing is to manage COVID-19, you have to have social distancing. You have to manage the air conditioning system, and you have to sanitize all the surfaces. It's as simple as that. If you can prevent people from coming close together, you can treat your air conditioning system so that the virus doesn't linger in the air, and you sanitize all the surfaces. Theoretically, you cannot have spread. Now, just to give you an example of how devastating it can be. Now, assume that one COVID patient infects 3 people. Now, within 3 cycles, 40 people will be infected. So if you have 10 people infecting 3 people each, within 3 cycles, you have 400 people. So therefore, it's not surprising that there are factories with 500 people infected, 1,000 people infected. Of course, if you don't control the spread, you are going to, that will happen. So what do you need to do? The most important, you got to cut and break the chain of infection between the patient and their close contact. Now, if you can cut that chain of infection, then only one person is infected. If you don't cut that chain of infection, you allow it to go down, you will soon have hundreds, if not thousands of people infected in your factory. Remember, you need to cut this chain of infection, but how? We'll show you how. So these are what you have to do to set up a complete COVID-19 mitigation plan in your workplace. Number 1, you need to set up a high-level COVID-19 task force. Okay? You must set up contact tracing and risk assessment program. This is the most important thing you need to do, to set up a contact tracing and risk assessment program. If you don't have this, there's no way to prevent COVID from spreading from in your workplace. So number 2 is the most important. Then you have to implement the MOH, SOP, 3W and 3C in your workplace. You need to manage your foreign workers, housing, transport, and observing the 3Ws and 3Cs to avoid the spread of COVID-19 in their quarters and buses and all that. You need to increase the airflows and or use plasma cluster ionizers and UVC lights to reduce virus in the air-conditioned areas. This is something which I think is quite important, as you can see later. Then you need to try to improve the general health of your workers with vitamins, supplements, and everything, which are quite common ones. And you need to continuously educate and make your workers aware. So this is the first step. You need to set up a high-level task force. Now, most companies relegate these tasks to their safety officer and or HR department. I think that's a fatal mistake, because nobody's ever seen COVID before. The kind of protocols you need to set up has never been set up before. The kind of decisions you have got to make has never been set up before. So if it's not headed by senior management and HOD, I don't think the task force can be effective. Our company has 26 people in our task force, and most of our executive directors are there. Our heads of departments are all there. Of course, our safety officer is there. Of course, our HR is there. but you need more than HR and safety officer. That's my message to you today. If you just relegate this to your safety officer, you're in big trouble. So what does this task force actually do? Well, you got to liaise with the Ministry of Health because the guidelines are coming from there. And these guidelines are changing every month. You know, they're updating the guidelines. If you are out of date even by 1 week, you could be, you know, contravening the MOH rules, and you could be, you know, fined. And then you have to liaise with other government departments and town council, because there's going to be 4 or 5 people that come to your factory. MITI will come, labor office will come, SOXO will come. So you have to liaise with all these people, you know, because if they come, they observe something they don't like, straight away you'll be fined, right? And if you repeatedly do it, you may be arrested, right? So you need to monitor local and international COVID situations. You need to know what's happening. If the COVID is raging all around the world, you know it's not likely that it's going to stop in Malaysia. And then you have to look at the inputs of COVID-19 research on the vaccines and all that. All this you must do. And then you must discuss, disseminate, and make decisions. And then set up protocols and an action program. So this task force have to do all this, right? Therefore, you need all kinds of people, from safety officers to, you know, COOs to even CEO. I sit on it myself, but I mean, I'm not insisting every CEO must sit on this, but it's good to have senior managers. So, so now we have this task force. What does it do? Well, you have to set up protocols, but it must continuously review and update to maintain relevance, right? If like before, we had to quarantine them for 14 days, and then as it's gone now, it's only 10 days. So you have to continuously follow the SOPs from the government, right? And then you also must look into the international situation and COVID-19 research as well, so that your protocols are relevant. You know, there could be some new discovery that you know, something, then you have to take note of that. So basically, we use these protocols and we translate it into a program following 3W and 3Cs. We use technology and engineering to treat our air and our facilities. We have a scientific approach to improving general health, and we train and make people aware. Now, these are the most important assumptions you need to make. If you don't make these assumptions, you're going to be in trouble, okay? The first assumption is you cannot prevent COVID-19 positive persons from entering the workplace, since 80% of younger people do not have symptoms or only mild symptoms which doesn't result in fever. So if you are using a temperature to measure people coming in, you probably miss more than 50% of the COVID patients. So this is the first point you must assume. You cannot prevent any COVID patient from coming into your premises. Now, you have to assume that everyone in your staff is a potential COVID-19 spreader. Since you cannot detect the COVID patients anyway, you have to assume that it can be a COVID patient and a spreader. So your mitigation program must be able to prevent them from spreading COVID-19 in your workplace. If you cannot, then it is no use. So these are the 2 assumptions you have to make. So what is the most important first step? You need to set up a proper contact tracing and risk assessment program. Without this, you cannot prevent COVID from spreading. No way to do it. You cannot screen, because screening is only as good as the day you screen. You cannot clean. Cleaning is only as good as the day you clean. If you clean one day, next day a COVID patient come out, your whole place is contaminated already. Cleaning is no use. And screening is even worse. You screen everybody. By the time you screen the last person, the first people could have been infected already. So all those things are not going to help you. If you think screening and cleaning is going to help you prevent COVID, I think you're going to have a very big problem. So the only way is to set up a close contact tracing and risk assessment program. So how do you do this? So first, we must define who are close contact. Now, for this, we follow the MOH. That means family members, same house, people working together in offices, okay? Of course, classmates we don't have, right? Those are people who are considered close contact if they were to contact the COVID-19 positive case. More than 15 minutes communication, less than 1 meter distance away in a confined space with a COVID-19 positive patient. That is a close contact. In the office environment, which is you can be more than 1 meter away for more than 2 hours, you are considered close contact. If you were near somebody who's coughing and sneezing and not wearing a mask, okay, even when you're passing by and later that person had COVID, you are close contact. If you are in a car less than 2 car seats away from the COVID patient, you are close contact. So these are the definition of close contact. We use this as the definition of close contact. Now, MOH does give you a status of the COVID patient chain. So they define people with COVID as category 1. And people in close contact with category 1 are considered category 2. And category 3 people are in close contact with category 2 people. And category 4 people are in close contact with category 3 people. Now, this is the definition given, guidelines given by MOH. So what we have done is that we have translated that into a contact tracing and a risk management system. So how do we do this? So first, you must have a simple form. Now, of course, you can use it electronically. I'm not saying that you have to do it. But remember, you are not keeping the form. The employer is keeping the form. It can be a book, a logbook, right? So every day, the person has to record down the people that has been in close contact with that person according to MOH definition, assuming that everybody is a potential COVID case, right? So if you spend more than, let's say if I sat in this room today with more than 2 hours and there are 2 guys, 3 guys here, right? Then I'm in close contact with them, right? So you have to record all the close contact daily. Once anybody in the company becomes category 1 or 2, we need to retrieve from the individual 14 days of records, because this is MOH rules. You need to check close contact of the patient for 14 days, all the people in close contact with the patient for 14 days. Now, if you didn't have this close contact daily log, how would you know? Nobody know, right? So there's no choice. In fact, if you don't have this, you're contravening MOH regulations, and you could be fined $50,000 straight away, right? Because this is what they need you to do. If there's any patient, they want to know who are the close contact for 14 days. So the only way to know is to fill in this form. However, close contact, cross-infection can happen from external, right? So everybody in your company must be mandated to report if they have been in close contact with COVID-19 positive patient, okay, in category 1, 2, or 3. That means even if you are not in direct contact with category 1, which is a positive patient, you are in contact with somebody that has been in contact with category 1. Like you send your son or something to a nursery, right? And the teacher got the COVID-19, right? You are not category 2. Your son is category 2, but you are category 3. But you must report to us as well. Because why? Because if your son will test positive, then you become category 1 or 2. So this is very important. Huh? Not only within the company, you must make sure outside the company, people are also reporting their close contacts to COVID patients. So basically, it's as simple as that. List down your close contact for the day. Who are your close contact? Less than 1 meter, more than 15 minutes, same room, 2 hours, record their names and where you meet them. Once anybody in the company becomes category 1 or 2, you need to retrieve the 14 days record of the individuals, and after that, a risk assessment will be conducted. So this example, that this person, Dr. Kaur, in the food lab, she met with these 3 people, and in the SS lab, they met with these people, and then food lab, and they are from which department? And that's for that day. Let's just say that was, I don't know what day it was, maybe the 5th of February or something. So this is an example, okay? Now, once you got the contact tracing done, now what happens when you have a COVID patient? Then we have this template here that does the contact tracing and risk assessment. So category 1 is a patient. You can't do anything. The government will decide, the MOH will decide what to do with the patient, to send to hospital, to send to quarantine, or to remain at home. However, all the people in close contact with the category 1 person need to undergo home surveillance for 10 days. And you need to do the RT-PCR test. This is the single most important thing you need to do. You must quarantine these people for 10 days and do the RT-PCR test. Why? Because of category 3 and 4. Remember, once the category people, 2 people stay at home, the category 3 people technically has to stay at home as well, or must be limited movement in their workplace. This is the MOH regulation. So how can they come to work? Only if the category 2 people are tested negative. If they are tested positive, straight away, this category 3 people become category 2, and category 4 become category 3. So if they are tested negative, then all the people in category 3 can go home, can come to work, right? So it's very important you test. You don't test, you have to still quarantine these people, because they potentially, if anybody was positive in category 2, they potentially become category 2. So this is why testing of category 2 people is 100% mandatory, in my opinion, if you want to have no problems with your factory running. So how do we do this contact tracing and risk assessment protocol? So basically, let's just say today we identify somebody called Sam in the logistics department, and he is positive, category 1. Then we look at his close contract for 14 days, and we saw 3 people, Raju, Abu, Akal. This is only hypothetical situation, not real. The real will be much more. We're just talking about hypothetical to make it easy for you to understand. Now, after that, we did the close contact tracing. So we did a contact tracing of these 3 people, and we found Linda, Fauzi, and Christina in category 3. And then we traced the contact tracing for category 3 to Ali, Siti, and George. Okay, so we have here category 1, 2, 3. Now, what happens? Okay, if Raju become positive, that means category 2 positive, straight away, okay, all the people in category 3 together with the people in category 2 has to become category 2, right? And then all the people in category 4 has to be category 3, and you have to start contact tracing all the people that have been with category 3, formerly category 4, and they will be in category 4. So imagine if another 1 person was positive here, then you move again. So that's why it's so important you test category 2 and you break the chain of infection. You don't break the chain of infection, you'll never be able to control it. Okay. Now, this is actual example of our first and only COVID case in our prime facility. So we have a lady that worked in a small room with 8 other people. So category 2, 8. In fact, some of them were just facing each other. And then we checked, there were 19 people in category 3 and another 65 people in category 4. Now, in those days, we didn't have such good protocols, so they were able to go everywhere. Now we have very strict rules, like they can't have lunch together, for example. And then the surah, we have now limitation on time and must wear masks. In those days, we didn't. So there are many things we have done since then. But what I'm trying to tell you is this. If any category 2 person was infected, then 92 persons will have been quarantined at home or semi-quarantined in the office. And very likely, our office will have to close. So you can see, if you didn't break that chain, we didn't have all those facilities to break that chain of infection between category 1 and 2, our office will probably have to close. So this is why it's so important. Now, let's talk about the test. A lot of confusion. So let's just say there are 3 types of tests: PCR, antigen, antibody. Antibody actually doesn't tell you that a person has COVID. It just tells you a person had COVID. So it's actually useless as far as what we are trying to do. However, it is useful to do a kind of mass screening for exposure. Let's say you've got 10,000 people and you test maybe 5% of them, and you see that some of them had COVID antigen antibody. That means they probably had exposure to COVID, right? So, or after vaccination, you may want to do this. But here it's useless to us for establishing whether somebody has COVID. So now we look at PCR and antigen. Now, basically the difference is the PCR tests virus genetic material. Both uses a nasal or throat swab. It takes about a day to do PCR to 1 week, depending on how rushed the lab is. It's highly accurate. It's probably about 95% accurate, okay, sensitivity. but it will give false positive if tested on COVID-19 recovered patients. So you have to be careful here. Whenever somebody has recovered, don't do this test. Otherwise, you're going to get a false positive. What is antigen test? Well, basically, it's testing the protein from the virus, right? And using the same system, it takes 15 to 30 minutes. It's accurate about 90%, but false negative can happen, especially for asymptomatic patients. So you need a PCR confirmation every time you test antigen, right? But it has certain uses, which I will show you. So basically, antigen is testing for protein. So when you have very low level of infection in asymptomatic patients, then maybe the level of viral protein is still not high, and therefore you can't detect it. So be careful. We don't think it's very useful to use this on screening of asymptomatic people. Yeah. So basically, what it means is to repeat this: all category 2 people must be tested using RT-PCR. Since antigen test may not be sensitive enough for asymptomatic patients, so you cannot use antigen for asymptomatic people, in my opinion. This is the most important testing you need to do, and it's the core of risk mitigation program. Any category 2 person that is tested positive will require all category 3 people in close contact be tested at quarantine. So if you don't test them, how do you know? So this is the most important thing you need to do. MOH does not require any testing of recovered COVID-19 patients after 10 days. So please do not test for PCR and frighten yourself and make the patient really miserable, feel like a leper, the family avoid him, the staff avoid him. And psychologically, it's really terrible for these people if they were treated like that. So please do not test PCR on recovered 19 patients. The government do not require you to do this, so you don't have to do this. Now, where the antigen testing, RTK antigen testing is useful is if you suddenly find a staff got fever, cough, all kinds of things. You need to know immediately whether this person is positive, right? So you must quickly do an antigen test, which you can do in 15-20 minutes, and then confirm later with RT-PCR. So if that person is positive, you can immediately do all the contact tracing and the risk assessment without waiting for the PCR test to come. So the RTK antigen test can be useful. Now, now we look at the MOH guidelines of the 3 Ws and 3 Cs. So follow 3 Ws and 3 Cs. So what are these 3 W? So you must wash your hands, you must wear masks, okay? You must warn people about wearing masks, you must warn people about coughing and sneezing, you must sanitize, and you must go and see a doctor, right? It's very cute, it's very cartoonish, but this is the guideline, right? To avoid, you have to avoid crowded places, confined places, and close conversations. So these are the guidelines the government has given to us for social distancing and avoidance and mitigation. So we need to translate that into a protocol and program. So this is what we do. Now, I think all of you have this, temperature screening, health declaration, sanitizer, signage, My Sejahtera, manual registration, social distancing. But does this prevent you from COVID patients entering your premises? No, like I explained to you, no way temperature can be used for that. However, if you detect somebody with high temperature, more than 37.5, what do you do? Of course, you deny entry. But if your own staff, are you going to send them home and make things even worse for them? No. You must send to see a doctor. Let the doctor decide whether the symptoms require testing for antigen and for PCR. Or if it's just food poisoning, they go home. So do not make that decision or sending them home. Send them to see a doctor. Let the doctors decide. Okay, we are not doctors. We can't decide that. So you have got to give everybody a mask. We give them free. Otherwise, who's going to wear a mask? We don't give them, right? So everybody has a free mask. Okay. Now, this is how we use the 3 W and 3 Cs in our office to minimize physical contact and to isolate. So if you are well-to-do on the top left-hand corner, you can use some specs, fancy, can see each other. But if you want to save money, like we do in some places, El Cheapo, use some cardboard, it's equally effective. Doesn't really matter whether it's specs or this. Now, all the conference room, like this room, normally can sit 10 people. Now we have a maximum of 4. You need to, of course, have space between seating, and you do got to have virtual meeting. Virtually all our meetings are now by teleconferencing. We don't have any more face-to-face meetings. Then another thing you can do is that if you've got a big office or training room like this, you partition them into smaller rooms, okay? So that if anything happens in one room, you don't have all the people in the same room being infected, right? Or being quarantined, right? Because if you are 2 hours with a COVID patient, even if you are 1 kilometer away in the aircon room, you still consider a close contact, yeah? So this is partition them into smaller office. Now, another thing we did is that we sort of mix up our department people. That means finance, logistics, trading, technical, we mix the people up. Why do we do that? Because if any one of these departments were to go down, we don't lose the whole department. That means there'll still be finance people sitting in other departments. So this is just a prudent thing to do, right? Just mix people up. Don't put all your eggs in one basket. Anything happen, you are finished. So this is something which we did, which you may not be able to do. We close our canteen because we find that there's no way to eat with the mask on, right? So once you take off your mask, it's open day already for the virus. So how can you have close contact, social distancing when everybody is take off their mask in the canteen? I find hard to reconcile that. So we close the canteen. So what we do is that we ask the staff to eat in the workplace. We put some tables for them, whatever. So they don't eat all together, right? So they isolate their eating as well. So basically they queue up and they take their food and they go out, okay? And we have a rota for them to pick up. So different department to pick up different times. Now, if you can do that, or if you want to open your canteen, any COVID patient, I think you're going to be in trouble, right? So now we look into the workplace itself. So obviously the first is the locker rooms. Now this is very important because if everybody crowds in here, and they go in all directions, up and down and all this, you're going to have a lot of possibility of infection. Because when they take off their clothes and not take off the clothes, when they change their clothes to work clothes and all that, they have to take off their mask and everything. So very dangerous place. So we, of course, we have to have sanitizer, but then we have a direction. They can only go this way and back, and then we have to social distance them, you know. So we don't allow them to, they must be within the box. Only 5 people can enter, for example, for here. And then they must have a maximum of 5 minutes, right? It means they can't spend more than 5 minutes. So this is the common sense, you know, so the SOP is here. So you need to have a very good SOP here because you can infect each other in the locker room. And then this shift is another important now. If you let people just enter your factory, right, without controlling them, what's going to happen is the people who come early will go into the workplace and then you're going to infect everybody. So when we have a COVID problem, both shifts is gone. So what we do is that we don't allow people to come into the workplace until the right time. And when we change shift, we put them opposite each other, more than 1 meter, and then they move into the boxes, and the shift over time change is 15 minutes, right? I hope you understand. Huh? We put the new workers here, the old workers here, they cross at the same time in less than 15 minutes. And then in their workplace, we have make sure they are separated by 1 meter and with respects. Now, in the surau, obviously, we also have a lot of things, we mark out things. This is very important because a lot of people tend to underestimate the surau, and that's one place you can have a lot of problems if you're not careful. So very close distancing is very, very important. Now, on the disinfection activity. So remember, the surfaces can be full of COVID. So we use something called Vircon S. This is a very effective thing, but you can use Clorox, but we prefer Vircon, but it has to be mixed every week. It's a bit of a mess, but we think it's much better than Clorox, but I think Clorox is okay. And chlorine, of course, evaporates very fast in the tropics, and we're not sure what the concentration of chlorine whenever we use Clorox. So we have decided to use Vircon. So every day we disinfect our offices, canteen, guardhouse, surau, meeting room, toilets, and foreign worker dormitories. And we mist periodically at 3 times a week. So basically these are the cleaning and these are the misting. So you need to clean and you need to mist. Okay. Now, foreign workers. Now the obviously the transport is a big problem. So we have to disinfect the bus every time before we carry people. We have to kind of alternate them. And more important, we don't use air conditioning on the buses. And we try to have the trip less than 20 minutes. I know it's going to be more difficult for some of you, you can't do 20 minutes, but at least don't have air conditioning, okay? And alternate the sitting and disinfect every time, okay? And these are the quarters. Now the quarters are important. Now there's the Act 446. You can study that. there is a lot of conditions there on accommodation, minimum standards, and management of accommodation, and there are many requirements. So if you were not to follow, the MOH is liable to fine you 50,000 and give you a lot of warning. So you have to make sure that everything, and then we also, they have to disinfect daily, and we miss 3 times a week as well. So there's a lot of notice boards and everything. This is very important. And then you need to a quarantine center. Now, I know most of you will be shocked. Hey, why do I need to do, what do I know about quarantine center? No choice. You're foreign workers, you need a quarantine center. Anybody with COVID, you have to send them to this quarantine center, and you have to liaise with MOH. They will help you to manage the patient. You don't have to manage the patient, but you have to have a quarantine center so the MOH can track it. Okay. Now, now coming to a very important thing which we did, which perhaps I don't think anybody has done from what I can see. Now, normally, if you're a centralized aircon office or factory, you have a fresh air intake of 10 to 20% of total airflow. Therefore, the total airflow change is between 1 to 3 times per hour. More, honestly, closer to 1 to 2, very seldom 3. The relative risk reduction of virus transmission will be reduced by 40 to 78%. So average about maybe 50%. That means if you have airflow around 2, you can mitigate around 50% of the virus in the air. Now, to achieve a 90% risk reduction, you need to require 4.5 times of fresh air change per hour. Now, it's very difficult for most workplaces and factories, and there will usually be not enough cooling and or airflow. However, if you can treat the return air, the 70-80% return air or 80-90% return air using a UVC light and plasma cluster ionizer, you can reduce the viral load by more than 99%. And then you can achieve air change of viral-free air to more than 10 times. So let me show you what it's about. So first, let's look at the American Industry Hygiene Association chart. So if you have, say, 1 change per hour, you have 40% mitigation. 3 change, 78. But if you can have 4.5, then you have 90% mitigation, which is the same as a N95 respirator. So you can, if you have 4.5 changes, like everybody is wearing an N95 respirator, that's great. But not easy to do 4.5 times, I assure you. So this is our own calculation for the office here, where I'm sitting here. So ground floor, first floor, second floor. So we have the space, we have the ventilation of fresh air change, and we have the air conditioning total air change. So if you can see that we only have between 2 to 2.4. Right? And here's a calculation. I don't go through. And we have 70% fresh air exchange. So basically, we can mitigate around 50%. Now, then we start we want to improve it to 99% or more. So we look into using ionizers, plasma ionizers, which have been tested to, in many countries to reduce the viral load in air by more than 99%. We use UVC, which also has the same thing. So we basically place these plasma cluster machines. These are the small ones, in the air outlet of the AHC. Okay, here, yeah, okay. And then we also put them in split cons. Yeah, look, split con. Let's say in areas where you're using split con, you put them here. And even in rooms, we put a small machine. A small unit with a HEPA filter, and in the air shield we put these big ones. Yeah. So we also use UVC in the return air duct and also shining onto the filter, which can be trapping viruses. However, we have a warning system where you can't go in unless you switch off the UVC light, because that's dangerous for humans. So basically, this is what we do. So basically, if you go back to the chart here, so when we do all these things, we are able to treat all the air. Therefore, our air change will go up to about 11.8 to 14 times. And you can see, if that's the case, then we would have 99% and above virus reduction. So by putting this UVC and plasma ionizers in our aircon system, we are able to reduce the viral load by more than 99% in our air system. Now, finally, we talk about awareness. So in our internal websites, of course, we have a section on COVID, and we put posters everywhere. You can get these nice posters from the MOH, and you can put them everywhere just to remind people they need to social distance and all this. So they are quite useful. So what are the take-home messages? Well, you cannot prevent COVID-19 patients from entering your workplace, as 80% of the COVID-19 patients are asymptomatic or have mild symptoms. You have to assume every staff is a potential COVID spreader. You need a strong high-level task force to deal with constant changes in regulations and situations. You must set up a contact tracing for every staff, daily contact tracing for every staff, and a 4-level contact tracing and risk assessment protocol. Some people do only 3 levels. We say cannot. Why? Because once the category 2 is positive, or the category 3 become category 2, then what happens? Then you are in trouble. So you must do 4 levels, remember, not 3. Your mitigation program must be robust enough to prevent the spread of COVID-19 in your workplace. You must follow MOH protocols and more. Not only MOH protocols, don't depend on government alone. You must use your own initiative. Government don't understand your factory. You know your factory better than anyone. So you have to use your own initiative to make sure your protocol are robust enough to prevent the spread of COVID. Now, there are emerging issues, obviously the vaccination, the type of vaccine. I just want to say something about this vaccination. For young people, it probably won't take place until the end of this year or early next year. So do not hope for vaccination to solve the problem soon, because all your workers are young. They're not going to be vaccinated at the end of the year. So between now and end of the year, 10 months, are you going to hold your breath or pray hard that COVID is not going to destroy your factory? No. Don't hope. Take action now. And besides, new variants might come, like UK and South African. So suddenly they tell you, oh, sorry, last month one you took cannot use already. Now must take again. Then how? So we don't know. See, the variants are like the South African variant is not very, the AstraZeneca is not effective against the South African variant. So we don't know what other variants are going to come. Now, the other thing is private involvement in COVID-19. You know, the private hospitals are very slow and reluctant to go into COVID-19 treatment, obviously. You know, they don't have the facilities, and you need separate entrances. You need, and then imagine your patients will all run away, and so there's a lot of problems there. But unfortunately, most medical insurance do not cover for COVID-19 patient treatment. So if your staff insists on getting treated in private hospitals, you have to pay something like 15,000, 20,000 deposit, you know, and it's going to cost you 20,000, 30,000 because every time they change the PPE, it costs a few $100s. So the guy has to change PPE 3 times, 4 times a day, you know, per person. So the cost is phenomenal. So if you have to treat your own staff in private hospitals, you have to make a big budget for that. Yeah. So thank you very much. But before I end, I just want to make an appeal to the government and to the industry, to FMM, to the Chambers of Commerce, to get together, form an effective task force with MITI, you know, the government with MITI and MOH, to look into the mitigation of COVID-19 in the workplace. 85% of the classes from the workplace. You don't address that, you are forgetting the elephant in the room. The government cannot do it alone. The private sector has to work hand in hand. So please, FMM, Chambers of Commerce, MOH, MITI, work together. We can defeat this. We have defeated this in our company. Everybody can defeat this. You just need to know what to do. And this is not difficult. None of the things we show you are difficult. We probably spend less than 100,000 in doing all these things. Right? Cardboard costs hardly anything. Changing airflow, plasma cluster, very cheap, buy from China. Virtually nothing, right? It's just not hard. We can do it. Thank you very much. Okay.
Okay, thank you very much, Soon Bin, for such informative and interesting presentation with a lot of important and practical recommendations. Before I proceed to the Q&A, let me inform you that we have now 269 persons signed in by Zoom. And I would like to thank FMM and the media for helping us to promote this event. Okay, so now I would like to also thank the FMM President, Tan Sri Dato So Tian Lai, for rushing back to the FMM office to join us after attending the MIDA board meeting. So if Tan Sri, if you are ready, I would like to invite you to start the ball rolling by making a brief comment and asking a question, please. So can we get Tan Sri's visual on? Or Tan Sri, can you get your voice over?
Tan Sri Ko, thank you very much for inviting me. You have done a good job. Can you hear me?
Yes, we can hear you. Thank you.
Yes.
Thank you.
Tan Sri Ko, Chairman of the Wawasan Education Foundation and also Chairman of the Board of Governors of the Wawasan Open University. Anyway, we still meet you in politics, but
no,
now
I'm not involved
anymore.
in politics anymore. No.
You're no more involved.
Yeah, I'm in education now.
Educationist now.
Yes.
Okay, Dato Dr Neoh Soon, Managing Director of Sun Group. First of all, let me compliment Tan Sri Ko and Wawasan Open University for organizing this webinar to share the importance of COVID-19 mitigation in the workplace. What I would like to say, the discipline is very important. Without discipline of the industries, this COVID-19 pandemic preventions will be tough jobs. Thank you, Dato Dr Neoh, for that very insightful sharing of how your company has put in place the necessary measures and precautions to mitigate this COVID-19 at your workplace. Thank you, Doctor. On our part, FMA has also been reminding and urging our members and the business community to do our part because it is everyone's responsibility. Even though we have nationwide vaccination plans, if the industries did not practice stringent SOP, the COVID-19 pandemic will still has a big serious impact to us. Dato Dr Neoh's sharing this afternoon is a testament that having such protocols in place can indeed prevent further financial impact, operational disruptions, as well as reputational damage to the company. I hope this will trigger the necessary actions of the rest of the business community, especially FMA members, who have yet to have in place an effective mitigation strategy as the pandemic is far from over, as we just embark on the national vaccination program, which will take till February 2022 to be completed. This is what I would like to share with everyone. My question is to Dr. Neoh, your protocols that put in place, do you think that the successful rate is how high?
Well, so far we never had any cross infection, so we wouldn't know. Obviously, it cannot be 100%. But put it this way, at least with the contact tracing, we have a good chance to isolate the people who are positive and who potentially can be positive. I think that's the most important. If you have COVID-19 positive people wandering around in your factory and you don't know that, then that will be a disaster. So the contact tracing and risk assessment is the most important thing you need to do, right? And whether or not your aircon systems and your barriers and your close contact, social distancing, all that can work, that's another point. The point today is that you have to know if there are COVID-19 patients in your workplace or potential COVID-19 patients. So contact tracing, risk assessment, most important. I can't know, there's no guarantee 100%, but you can see what will happen. You will know what happened if you didn't. You can see so many factories, like every, last week, Saturday, furniture factory, again, closed down. The week before, chicken slaughterhouse. The week before, so every week, if a major company is shutting down, right? So you know what is the consequence if you don't. So there's no guarantee in life, but at least you know what will happen if you didn't. So it's better to do something than nothing. Right?
Tan Sri Kong, can you allow me to ask another question?
Yeah, please go ahead.
Please go ahead. Please go ahead.
The second question is like that. With this protocol is good, but currently the government also implement 30% management staff work from home. Will this effective to bring down the COVID-19 pandemic infections? Because the government's already opened up most of the industries. They got pasar malam, pasar pagi, everywhere. It seems like it's open. So do you think that it's necessary to have this work from home management staff with this 30%?
Thanks, Priya. I'm hoping that FMM will take the leadership to talk to the government about this, because this is a very, very disappointing thing for a lot of people, simply because, we are facing a crisis today with a pandemic. Not only we have COVID problems, we have supply chain problems. There's so many problems in this country right now, right? Not only the COVID problem, because there's all kinds of problems. So we have a situation where all the workers are allowed to work. So of course, the factory will make sure all the workers come to work, but only 30% of the managers can come to work. Now, first, you're facing a crisis and the managers are all at home. And if you look at it from a worker perspective, I'm a worker, I come to work, I'm facing COVID risk. My managers are hiding at home, enjoying their wife's cooking or their husband's cooking, How can this be demoralizing, right? This is so demoralizing. I think that's not good. We should not hide at home when our workers are all facing COVID, We should at least be here to show them that, look, we are here, like I'm here, I'm not hiding at home, right? So that's important. I think this is not a good thing to do right now. And besides, if you look at the number of people that have COVID in the group, which you're asking to be at home, I believe they are the lowest of any group, because these are highly educated people. They have big houses, or not big, they have comfortable houses. They don't have to share buses. They are coming by car. And these are the people with the least possibility of being infected. And you put them at home. But the workers which are living in close quarters don't have ability to share. They come by bus or whatever. So it is very ironic that the people, the lowest risk factors, which are the executive and managers, are quarantined at home, but the workers, which are the highest risk, are working. So I don't understand that logic. Maybe the FMM can explain to me why this is so. I don't understand this.
Okay, Dr. Neoh, we will take note of your advice and we will do the necessary to highlight to the government on this. Thank you. Tan Sri Kong, I already asked 2 questions.
Yes. Tan Sri, so thank you very much for rushing back from another very important meeting. And I think Dato Dr Neoh has a very good point about this 30% rule that should be reviewed and revised by the government together with FMM and all the chambers and trade organizations, because it's very important that we know scientifically what is the basis and what are the measures to be taken that would be even more effective, rather than to have a 30% rule. So now we would like to answer. I'm going to post on behalf of several people who ask questions that are a bit more medical, but in terms of the test, okay? I won't mention the names because there are people who ask about the same cluster of questions. Now, when is the best time to conduct the RT-PCR after exposure to positive patient for more accurate result? Then a related question is that during the PCR test, worker was found positive, right? But when would the virus then be clear from the person? And then how many times the PCR test should be taken for category 2? This is another related question. Then the other thing is, I think that I'll then move on to another question later, but I asked Dr. Neoh to answer this PCR test issue briefly.
Okay. You must
Yes.
remember, PCR is a test for viral genetics, the RNA. So it's very sensitive test, obviously. I think it's a few factors for I can't remember how many times, but it's much more sensitive than the antigen test, which is a protein test. So if you have somebody, let's say a category 2 person, which is asymptomatic, obviously if they're symptomatic, you have to test them already. Let's say asymptomatic. You should not use the antigen test because it's very likely to give a false positive. So for asymptomatic people in category 2, you must give a PCR test. Okay. Now, however, for COVID patients themselves that already have the virus, remember the viral material can last up to even their cases, even until 9 months later, they still have viral material in their body. So what happens when you test somebody, they have residual viral material? They are not infectious. Remember, this is dead virus, not living virus. Dead virus, viral debris. Now, if the viral debris exists in your body, and it could be 6 months later, like our case, the mother of our first case, recently got tested. That was in November, and it was March, right? February. So 4 months later, she was still positive. And immediately, of course, our managers all panic, and even though we tell them it's okay, they quickly isolate her and so rounded everybody up. I said, what are you doing? You're creating panic here, right? That person, it is not infectious, right? It's because of viral debris. So do not test recovered COVID patients with PCR, please, right? You're going to create a nightmare for yourself and the family, right? And people start isolating those people, so it will create a chain of events that will lead these people to feel like they were lepers, So please do not test recovered COVID patients with PCR. You don't. If you are scared, test antigen. Antigen will show you whether there's still active disease, because if there's still active disease, there will still be protein, but not this. So I think that's important. PCR test is not for recovered COVID patients, but it's very useful for people, asymptomatic, potential person under investigation, what we call PUI. For PUI, you should use PCR, not antigen. Okay. I hope that's clear.
Okay. Yeah, I think it's quite clear. Now, another question posted is about the UV device. The concern is that the wavelength of 200 nanometers would still be harmful to human on the skin and eye. So how to ensure it's safely used so that it will not affect the workers? Secondly, the UV light tube is glass material. How can it be used in a HACCP food premise?
Okay, let me go to the slide first on the UVC. That's the one. No, sorry. Go down. Wait. Go down. Go down. Okay. Let me get to the UVC. So I explain to you. Yeah. Okay.
Oh, right. You want to show the slide?
I show you so that I think there's some confusion here.
Yes.
Okay. I think the most important thing you have to understand here is that the UVC is in your return air duct at your AHU, your air handling unit of your aircon. The UVC is there. And inside the room which houses your AHU, all right? and there is an auto lock here. That means no human being can enter this room unless they switch off the UVC. The UVC is not in open air, it's inside the ducting, the return air ducting, okay? That return air ducting, right? So this is actually, there's no way this UVC is going to get to near human. So you have to put it inside the ducting, not in the office space, unless you intend to permanently retrench all your workers. You know? so you are not supposed to do that, right? So yeah. I think it's the most important. You have to put it in the return air duct and on the filter, and inside a room that has a safety lock that nobody can enter unless they close this light off. Right. So that's the okay. Is that clear? Yeah. Then on the HACCP. Now, I do not want to go into details on HACCP. HACCP obviously do not allow you to use any glass material, but however, if inside a ducting, I don't see any problem. I mean, it's inside a ducting, which has the ducting need not be in the factory. The ducting can be outside. So as long as the UVC is inside a ducting outside the factory, I don't think a problem with HACCP, right? That's my view. It should not be a problem. Okay.
Okay. Now, another question. How do you control external individuals who are involved in the transport of your workers, suppliers? And a related question is, shall we disinfect incoming goods documents as these items are transferred from hand to hand? What is your SOP in your factory?
Okay. At this moment, we do not see that as a high risk of handling of documents. We do not see that as a high risk, all right? And generally, I think globally, people do not see that as a high risk. So we don't go paranoid and try to sterilize all the documents UVC, right? But I'll be honest with you, I have a UVC and ozone cabinet in my own office. If I receive any, shall we say, e-commerce things, parcel from Lazada, I put everything into that box, I press a button, let the UVC and the ozone kill everything, then I will take out the box. That is being paranoid, okay? Because I'm old, I can't afford to get COVID, right? But so far, we have not mandated that documents have to be sterilized. Otherwise, you have to sterilize all the money, right? The worst is money. In fact, I never use money. Yeah? Money is dangerous because that's the most interesting, right? It's passed through. So basically, we cannot do that. Otherwise, the whole country will in chaos, right? If you institute that, then. But on the contractor, we do have some mandate that they have to be tested, okay, with COVID. But more important, we don't allow them to do in close contact with our staff. See, that's the most important. So therefore, you must close your canteen. If you don't close your canteen, and the lorry driver goes to the canteen, and you have 5 people there having a tea tarik with him, you had it. So the most important is to have social distancing with all the contractors, right? That is the most effective thing. So it's not about, of course, for those who come often, like our construction people, we ask them to test PCR once in a while, all the workers, but you can't do it every day. But your protocol is the most important in that case, right? You must depend on the protocol to prevent cross-infection. Like I say, you cannot prevent COVID people from coming in, but you must prevent them from spreading the disease. So our system, I can't go into details, but our system should be able to do that. Okay.
Right. What about your suppliers and all that?
Yeah, that's right. Suppliers, when they come, if they are regular coming, like contractors, supplier of certain, let's say, construction workers or something, we will require those workers to be tested. And of course, we have a protocol to isolate them. We don't let that mix with our people. We are social distancing. We make sure they follow all our SOPs, etc., right? We cannot do more than that. But so far, like I say, I don't care. Even the supplier is positive. He walks into my factory. If my protocol is good enough, he's not going to be able to spread it, right? That's the point. You cannot prevent people coming in, but you can prevent them from spreading it. That again is the most important point we have to understand here, right?
Okay. Now, we are happy to have another important person who is actually Dato Sri S.H. Wong, the president of the Malaysia Semiconductor Industry Association, representing the electronics industry. And he has a couple of questions and comments to make. Can I invite Dato Sri S.H. Wong, please?
Yeah, thank you very much, Tan Sri Ko.
Hi.
Hi.
First of all, let me thank you for organizing, and also Wawasan Open University for organizing this talk. Very timely, very important to the industry, and also to Dato Dr Neoh for sharing all his experiences in his own factory and in his own company. As you know, the electronics industry is a very important industry in the country. You know, it contributes 38% to exports, hires about 560,000 jobs, and contributes about 6.3% to the GDP. So the companies today are operating with all this very strict SOP, and they have faced all the problems that you have mentioned, Dr. Neoh. You know, factory shutdown, quarantine, social distancing, and all that. So they have done a lot, and they are, you know, one of the, I guess, we are one of the industry that really follow the SOP. However, one question to you, Dr. Neoh, is that, you know, we face challenges, and one of the challenges is that the employees, you know, as they come to work in the factory, they are very well disciplined, okay? But we are not sure when they go home and mixed with their friends, their family, and when they go out, and in particular, the foreign workers, you know, after they leave the factory, they go back to the dormitory. How do you get behavior change such that they will still follow all the protocols and SOPs when they leave the factory, so that they don't bring it back at a later date? Thank you.
I think, I'm not sure you say you follow all the protocols, because the MOH protocols are very, very, shall we say, simple, as you have seen. I'm not sure if all the factories have 4-level contact tracing, 14 days. I'm not sure. If you tell me they all have, then I say good. But if they didn't have that, there's no way they can control the spread of COVID, like I told you. No way. If you don't have 14-day, 4-level contact tracing for every staff, there is no way you can prevent COVID from spreading in the workplace. This is the most important statement I have to make today. If you don't have that, so unless you tell me all the factories have that, fine. But I doubt it. Okay? I have not, honestly, I have not met another factory that have that right now. Okay? So I don't know. I don't want to comment on other people's factories, but I haven't met anybody that actually have that right now, what we have. So that is, I think, a big problem. Now, on the situation where the people get infected outside, like I said, if your system and protocol is good enough to prevent the person from spreading, like we have one patient with 8 people in a room about this size, smaller. None of them got it. So what you must have are protocols that prevent the virus being spread around in your factory. Right? If we can prevent a small room like this, 8 people, okay, with a positive COVID patient sitting there for almost a week, nobody got infected. Of course, that's what you need to do, right? Because you can never prevent COVID patients from coming into your factory. I already said that from day one, from the first instance. There's no way. You cannot control what people do outside. You can only control what you do inside your workplace. You cannot control what people do outside. Now, of course, we have told them, yes, you mustn't do this, but when we made it mandatory, if you were in close contact with any category 1, 2, or 3, you have to report us. If you don't report, we can take disciplinary action against you, right? This is most important. So if they say that, okay, my mother-in-law has it, so I say, okay, you are category 3, okay, fine, all right, or category 2 or whatever. Then you have to stay at home, right? So again, it is the discipline you must instill in your workers that will prevent this. Now, I am not really that convinced that the spread in the community is that bad, because when I look at the results from the cluster, 85% of clusters are transmitted in the workplace. So 85% of clusters are in the workplace. How much, is the transmission in the workplace? It's probably got to be more than in the community, right? So I dare to say today, the main problem is the spread in the workplace, because 85% of all new clusters are happening in the workplace for the last month. That must tell you something, right? So we can shut everything outside. You still have 85% of the virus going around, So I think we have to be realistic here. We have a problem, a serious problem, but there are solutions, right? The solutions are making a proper contact tracing, 4-level contact tracing, 14-day, risk assessment, right? Treat your air, proper barrier, social distance, so all these things. Why should the MOAs talk about all this if it didn't work, right? It works. It's working, right? It's not that difficult to do that. I think this is the most important point. Sorry, SH,
It's okay, no problem. But thank you.
I have to say this because I feel passionate about this. The facts show that 85% of all the clusters in the last 1 month are coming in the workplace. We have to bite the bullet here. We have to take responsibility that we are causing the problem. We cannot go and blame everybody. Oh, they went to a party, they went to a wedding, all that. No. The problem is here in your own workplace. You have to stop that. Yeah. Sorry.
Okay. Thank you.
Okay, that's Dr. Neoh has made a very important point. That the workplace is clearly the most contagious area. So I have a question from the public. In fact, precisely on this about the contact tracing. So the question is, the daily close contact log, does it need to be filled by everyone every time they come to the workplace, and they need to submit, or do they need to keep? How do you manage this log, and how do you train your workers the discipline to follow?
Okay, we make the heads of department responsible. So they have to do spot check. The log is kept by the worker themselves. We don't need to keep the log, right? Except for, let's say for my room, for example, I insist the foreign worker that cleans my room shows me the log every day because I'm cautious, right? But we normally don't demand to see. We'll spot check. Let's say today, say, okay, show me your log for the last 1 week. So you do spot checks to make sure they are doing it. But you have to make it compulsory for them to do it, right? And if you don't enforce it, and your enforcement can be through their, the heads of department. Their job is to do that. You have to say that this is the KPI, company KPI. If you fail, then sorry, your bonus increment all be impacted. Look, what can you do, right? You have to make the heads of department responsible, right? That's the only way.
And the point is that actually the logbook is kept by the employee until such time when there is outbreak or whatever, suspected outbreak, then you have to check, then they have to submit, right?
Yes, correct. But it doesn't, it's not a book, it's actually a form, but it can be a book, it's no problem. We don't care how you do it, as long as you follow.
A related question to that is that, there are certain apps that can do it. Would that be all right?
Okay, if you can afford it, you can design an app. But then to me, everybody filling a simple form every day takes about 1 minute, or, it doesn't really take a lot of time. Because most people would be close contact with most people. Like I say today, if I work in this office, I've got 3 people close contact with me. So every day I will write down those 3 people, that's all, right? As long as I don't meet for more than 15 minutes with anybody else in close contact, at least in less than 1 meter, they will not be close contact. So it is quite a simple form actually to fill in. I mean, my foreign worker, Nepalese worker, does it beautifully. If a Nepalese worker can do it, I don't think anybody in this world can do it, right? So it's not a problem at all. They keep it. We don't. But of course, for my deposit worker, I insist I look at it daily because my health is at stake. So I have to be a bit careful.
That's right. Good point. Good point. Now, I would like to invite another person who has been following this talk, and he is the former vice president of FMM, but still at the present moment, and still the principal representative of FMM in the important task force called Bermuda. Bermuda is the government industry task force to facilitate business, and he is the co-chairman together with the chief secretary of the government, and he's Dato Dr Neoh Soon. And I would like to invite Andy to make a comment and ask a couple of questions.
Thank you very much. Thank you very much, Tan Sri Chairman, for organizing this series, and also Dr. Neoh for sharing your good pointers with us on how you managed to cope with this pandemic in your company. As you rightly pointed out, we have a very challenging task this moment. And Bermuda, as you know, has been set up now for more than 15 years. We are also helping to ease the doing of business. But today we have another challenging task that Malaysia is facing, and that is on the impact of the COVID-19 virus. Now, during this period, as many companies would like to come back to work, when we first started, we started with essential companies that are dealing with essential products to come back. And today we realize that essential and non-essential are also coming back to the industry. Now, in company like yours, you have put in the discipline, but the discipline is very much based on the human factor. All right, like you say, you can't control what your staff do after office hour. You just hope that they will be disciplined. You can't also control the foreign workers that you have on their rest day, whether they do go out and mingle with others and all that. So this is also based on very much discipline. All right, but this discipline, I feel that can be instilled. It comes from like driven from the top, right? But one question to you is that, on one area, if you were to control the foreign workers in their quarters, confine them only, not to allow them to go out and do, their shopping or to have their free day off, right? Aren't you afraid that you will be accused of some human rights, which, as you can read in the papers, there are some companies being questioned on workers being asked to come back to work during the MCO period. And there are also questions about housing them under Act 446, but I will not touch on Act 446 at the moment. But assuming that your company has complied with Act 446 and that your accommodation has received the certificate of accommodation from Ministry of Human Resource. But I would like to stop here with those few. Thank you.
Andy, I fully understand your sentiment. Yes, all our facilities will be inspected by Human Resource Ministry, and I think they should have been certified already. So we have no major problems there. Now, I think the discipline issue sometimes is you need to give them a sense of shared responsibility. That's why I am very upset when, we were told that the managers don't need to come to work. How are you going to convince the worker to take you seriously if you're hiding at home and they are facing the bullets here? So I think sometimes we need to inculcate this sense of shared responsibility, that we are a family. We need to look out for each other. That's why our company go to extraordinary measures to help them if they have COVID, right? We even help their families, you know, because some of them die, right? So it's no joke. This is not a joke. It's serious. So you need to calculate. Like, you see, our people here, I can safely say, all our staff feel very confident, right? Because they know the kind of measures our company have put into to safeguard their health, right? They come happily to work, right? Because they know what we are trying to do for them. So I think if the management do not want to act and show the workers that they care for them and they value them, then obviously nobody's going to cooperate with you. To institute a sense of joint responsibility and shared responsibility is very important. We are in a pandemic. Okay, this is a crisis, right? They know if the company were to close down, their overtime will be gone, maybe the bonus gone, whatever. They know at the back of their mind, they can't afford the factory to close down. But if they feel hopeless, they don't know what to do, and the company doesn't know what to do, then they give up hope. They say, we can't do anything, it's hopeless. It's nothing we can do. So I think it's very important to start demonstrating that you are doing something for your staff. You are doing whatever you can to prevent. Now, I cannot be sure that my aircon system with my plasma cluster, my UVC, and my airflow rates can prevent COVID. Well, it has until now, but it doesn't matter because our staff know we are doing the calculations. We are bringing in the plasma cluster. This is a small unit, a very small unit. The ones we use are very much bigger. This is for like split con. We are bringing these things, okay? We're doing so many things, right? That is important. I think you need to show your staff you are taking action to prevent the spread of COVID. Remember, you cannot prevent COVID people coming to your factory or your workplace. You have to prevent them from spreading it. You have to cut the chain of infection. Otherwise, your whole company will be wiped out very quickly. I hope I can, I'm not sure if I answered your questions correctly, but that's my feeling, you know, that it's important the company work closely with their staff.
Yeah, I think it's very important that everybody act as a ambassador to the company. You know, like what Singapore introduces at when they first started MCO. They introduced the social distancing ambassador, reminding each other to keep our distance. Even at the queue, like workers coming in to clock their cut in the morning, right? They no longer have to use proximity now. They cannot touch the screen, all right? They have to use contactless, you know. So a lot of companies then migrate to all this system so that there's very little contact among each other. And also at the end of the day, ambassadors are there, which normally should be the head of your department and all that, making sure that they line up properly when they go out and go into the bus, you know. But the other control that I feel it's sometimes very difficult, even if you can fulfill the Act 446 by putting the beds, satisfying the mattress at 4 inches and all that. The next morning, sometimes some of the workers will put their beds together. And if you are bad luck, this JTK were to come and inspect, you know, you will be fined for, not keeping your beds at a distance. So these are disciplines very hard to maintain, that you do not know why do they put their beds together, why do they prefer to sleep on the floor, you know. So this discipline, it's a very personal one, especially when we are providing accommodation for under Act 446 for our employee, minimum standards that they expect us to meet. But we can give them all these facilities, you know, 6 person to 800 square feet or whatever it is. You know, how do you control that at night they do not move their beds around, they do not, put towels all over the place, which are not allowed. Thank you.
Actually, it's the same as your own other staff, not only foreign workers. You cannot prevent, if your staff wants to go and sleep next to a COVID patient, you can't do anything, right? The whole point is that you can't, whether it's a foreign worker or normal people. See, what do we do with foreign workers, and maybe it can help. I know we don't want to go too much into detail. Like, for example, we put our foreign workers here in 3 different areas which are not accessible by food. They have no means of transport, so they cannot. Okay. Yeah, so we cannot, we put them in locations which they are not accessible because they don't have any way of transport, so they can't walk, it's too far. So that what we do is that we contain them, in different areas. We don't put them all in one area. Then it's finished because they will go and visit each other, lepak here, lepak, you have it. So we put them in different locations, right? And to make sure that that if anything were to happen, you see, you're talking about mitigation. I never use the word prevention. I use the word mitigation. And this is part of mitigation. Don't put all your eggs in one basket. Don't put all your foreign workers in one dormitory. You finish if there's something happen. So we have 3 locations in Pride, for example, where we house our foreign workers, which are not accessible by walking, right? And they're not going to take Grab. Nobody's going to take them by Grab anyway. They can't order Grab. So these are things you need to do. Now, whether they're going to sleep together in the house, we cannot prevent that. We cannot prevent anybody from doing that. But at least we can mitigate it, right? So even if one house is infected, well, it's just one house is infected, not every house, right? So you must make sure these people don't infect the other guys, right? So your system, that's why I say contact tracing, all the barriers and the aircon and all these things are to prevent these people from spreading the disease. That is the most important, You can never stop anybody from catching COVID, you can't. But you can prevent them from spreading, I believe. Yeah.
Well, that's a very important message. I think discipline, information, training, very important. So a final question, which is raised by quite a few people. They would like to ask Dr. Neoh, what is your stand on mandatory vaccination for employees? Some may not want to be vaccinated. Do they have a choice?
Well, of course, this is a government thing and I can't really answer that, but I can just say about vaccination. Especially for people in high risk, I think you should vaccinate any vaccine you can get your hands on, right? Unless you've got anaphylactic reaction allergic reactions to anything, then you should vaccinate any vaccine that appears. But if you've got allergic reactions, serious allergic reactions, maybe you should avoid the Pfizer, right? But everything else should be okay. Now, as far as companies, all that, I believe if you were to set a rule in your company that everybody has to vaccinate, otherwise they can't come to work, you have to check with your lawyer whether that's against human rights. You may not be able to enforce that, but the government can. The government can make that enforcement, but we as a company may not be able to do so. I think we may have not the legal rights to do so. But vaccination, like I say, for our workers will not come until the end of this year. So you can still ask that question, 6 months down the road. But please do the rest first. Okay, ask the vaccine questions later. Do the social distancing, do the contact tracing, the risk assessment. Now, those vaccination issues will not be relevant to your staff for another 6 months, 9 months down the road, because they are not going to get vaccinated. They are in their 30s or 20s. I mean, they are the lowest priority, right? So if in the next 10 months, before they get vaccinated, your factory has to close 3 times, just imagine the cost to you. How much is, let's say your sales is 1 million a day. You close for 10 days, you lose 10 million sales. Is that important? Or 7 days? Now compulsory, 7-day close. If you have too many virus cases. 7 days, 7 million. Is that important to you? If you say, oh, this is so never mind. Okay, fine. But if it means something to you, you better do something. And then the morale to your people. How, don't you see that this is a big problem, morale? Can you imagine they go home and they say, oh, yo, mommy, daddy, how can you work for that factory? So many COVID one until closed down. I don't want to die, mommy. This kind of thing you finish, right? Even your own family will be up in arms against you if you work for a company that's forever COVID one, right? So you have to think about all these things. How about your customers? They're not come to see you also. They see your product. Oh, yo, this one for COVID one cannot. You finish. So this is for your own good. You have to think of that now, not about the vaccine 9 months later. Right now, we focus on the thing. Yeah.
True.
Okay,
True.
sorry.
Yeah. Actually, very good message that everyone must be aware that it is the duty, responsibility of everyone to make sure that we are safe, and only then livelihood can be sustained. Well, I would like to close this webinar by inviting the CEO and Vice Chancellor of Wawasan Open University, Professor Dr. Lily Chan, to say a few words at the right time, because soon we just talk about vaccination, and Professor Lily actually started as an immunologist and pioneered the biotech initiative in Singapore, was the deputy vice, was one of the vice president of NUS before she came to join us almost 2 years ago. So I would like to invite Lily to just say a few words to us. Lily?
Thank you, everybody. Hi. Thank you, everybody. Thank you, everyone, for joining this series. And we've called it WOU Shares. And I hope in the course of the next several months, the COVID-19 series will have part 1, part 2, part 3, part 4. And each time, the news coming out will be better and better and better. WOU Shares will also host other topics. So if any of you have topics of interest, do write in. Our team is here. We can take some cues from our colleagues in the industry. What are topics that are of interest to you? And we can put it as part of the WOU Shares. Okay. Vaccination, yes, I have taken my first dose. I'm okay. Just a sore arm. Second dose will be akan datang, right? So thank you very much, everybody, for tuning in this afternoon. And hope to see you all again. I really hope to see you all again. And thank you so much, Tan Sri, Ko, and Dato Dr Neoh. Thank you so much for helping WOU do this series, WOU Shares. Thank you, everybody.
Thank you, Lily.
Can I make a comment about Lily, yourself, and myself? You know, the three of us were in University of Chicago and, in the Chicago area in the mid-1970s. And we were known as the Chicago Mafia. It's very ironic. Mafia are supposed to kill people. Now we are trying to save people. What kind of mafia are we, you know? We're not a good mafia, lah.
Yeah, very good comment. Yes, very good comment. Now, actually, Soon Bin, there's been some requests also for you to actually dive in on mostly on contact tracing and risk assessment. So we may, conduct another, we will invite you for another session later on at a more suitable time. And then for you to elaborate and also to...
We need a workshop.
Maybe a workshop, but maybe a webinar with a few panelists to talk about it. Because there's a lot of issues on the ground that need a lot of sharing of experience.
Yes.
And the next round, we would also like to invite government departments to send some representatives as panelists so that the discussion could be more fruitful.
Yes.
Then finally, there are some requests for you to share the slides. And so we would ask those who want slides from Dr. Neoh to just email WOU, and we'll arrange with Dr. Neoh to send you the slides. I'm sure some of you have been snapping, using your handphone to snap a lot of slides, but I think it's not as good as sharing the real ones, okay? So thank you, Soon Bin, for your generosity in sharing your knowledge and experience. And I want to thank all of you for participating in this inaugural, the first webinar in WOU Shares COVID-19 series. And we'll have a few others coming to talk about different aspects of this COVID pandemic, okay?